everyone. I'm Dr. Otefe Debbie. I'm a consultant psychiatrist and a psychologist. I make videos on mental health education and self-improvement tips. My goal is to help demystify mental illness and provide you with mental health tips and self-improvement tips that will help you be your best and live your best. On today's video, I will be talking about dementia. This is the first of a two-part series on this subject, dementia. Dementia is said to be an acquired global impairment in intellect, in memory, and in personality, without it affecting one's level of consciousness. Here are 10 facts about dementia. Number 1, even though it is usually progressive, that means once somebody has dementia, it is more likely that the illness will keep progressing. The good news is this: not all dementias will always progress. In other words, it is not always progressive. Number 2, the presence of memory loss is a major part of the symptoms of dementia. But just having memory loss alone does not invariably mean the individual has dementia. Memory loss is one of the earliest signs of dementia, but sometimes also in dementia, memory loss is not very significant in the earliest phase of dementia. Number 3, impairment in cognition is usually accompanied by behavioral changes. So in terms of cognition, I'm talking about thinking and memory. But sometimes it may even be preceded by behavioral and emotional changes. In other words, in dementia, before it becomes obvious that there is a cognitive impairment, there may actually be behavioral changes in the individual. Number 4, even though dementia is readily and usually associated with older people being over 65, it does not necessarily mean that memory loss and the accompaniments seen in dementia is a normal phenomenon of aging. And in addition to that, dementia could actually occur before the age of 65, usually called pre-senile dementia. Number 5, over 55 million, approximately 55 million people worldwide have been diagnosed with dementia. And it is said that about 10 million are diagnosed each year. Now, as much as dementia is not necessarily a normal phenomenon with the aging process, but the older one gets, the more likely that individual may be diagnosed with dementia. One research showed that people between the age of 71 to about 79 years, which is about 80 years, there was about 5% prevalence in that group. And then for those above 90, in that particular research, there were more than 30% of people with dementia. Number 6, dementia results from a varying array of diseases, either directly or indirectly affecting the brain. But chief of all these diseases that can possibly cause dementia is the Alzheimer's disease. In fact, 60 to 70% of cases of dementia is due to Alzheimer's disease. Number 7, just like number 6, some other conditions that can result in dementia include vascular injuries. So multiple strokes can lead to dementia. There are infections that could lead to dementia. So infections like syphilis can have complications that could later be seen as dementia. Even HIV can have dementia-like complications. Apart from Alzheimer's disease, there are many other causes of dementia. Those ones are not usually common, but there are other possibilities. This is important because whenever the diagnosis of dementia is made, it is important to rule out some other possible causes, because some of those other possible causes are reversible. Chief of them, not of the reversible ones, but chief among the other possible causes of dementia is the vascular type. There are other types like the Lewy body type. There are autoimmune conditions that could lead to it. There are infections that could lead into it. There are vitamins deficiencies that can lead to dementia. So there are various other causes of dementia apart from Alzheimer's disease. Number 8 is that dementia is the 7th leading cause of disability among the older population. That is the population above 65 years. Number 9, dementia not only has cognitive impairment functions, but it also confers a lot of psychological, social, and even economic problems and challenges, not only for those suffering with the condition, but even for those caring for those with the condition. And finally, number 10, one can actually reduce the risk of having dementia in later life just by improving and changing and living a healthier lifestyle. That will simply mean cut down on your alcohol, cut down on smoking, be physically fit by exercise, watch your blood pressure, watch your weight, check your cholesterol level, and of course, check your sugar level. Just by living a healthier lifestyle, you are likely going to reduce the risk of having dementia. I hope this video has been helpful. Just in case it has, please do share it. And if you have not already subscribed to our YouTube channel, I would really appreciate it if you do that, so that you don't get to miss out on any of the subsequent videos. Thank you very much.